Hi everyone, I'm Kim from Group 2 and today I'm going to show you how to perform complete bed bath.
To perform a complete or partial bed bath, first assess the patient's skin and other factors.
How are you feeling today? Any areas bothering you? Itching? Would you like to use the urinal before we get started? I'm going to get water and I'll be right back.
After arranging all the supplies on the overbed table, raise the bed to a comfortable working height, lower the side rail near you, and help the patient into a supine position close to that side of the bed. Then place a bath blanket over him and ask him to hold the top of it as you remove the top covers. Now remove the patient's gown or pajamas. If he has an IV line, an injury, or reduced mobility in one arm, begin removal from the unaffected side first. Then take off the gown from the other side. Remove the IV tubing from the pump, take the container off the pole, and slide the container and tubing through the arm of the gown. Then rehang the container and adjust the flow rate as needed. Raise the side rail and then fill the wash basin 2/3 full with warm water, being sure to check its temperature. Also have the patient test the water temperature to make sure he can tolerate it. If desired, warm the body lotion in the water. Now lower the side rail and, if allowed, remove the patient's pillow and raise the head of the bed. Place one towel under his head and another over his chest. Then immerse a washcloth in water, wring it out thoroughly, and form it into a mitt as shown. If the patient is not wearing contact lenses, wash his eyes with plain water, bathing from the inner to outer canthus and using a new section of the cloth for each eye. If needed, soak any eyelid crusts for 2 to 3 minutes before removing them. Dry around the eyes gently and thoroughly. Next, wash, rinse, and dry the patient's forehead, cheeks, nose, neck, and ears without soap. Or if he prefers, use soap to wash these areas. Ask a male patient if he wants to be shaved. For an unconscious patient, use a washcloth to clean the eyelids from the inner to outer canthus with plain warm water. If prescribed, instill eye drops or ointment. And if the patient has no blink reflex, keep the eyes closed and covered with an eye patch or shield. Now remove the bath blanket from the patient's right arm and place a towel under it and the basin under his hand. If you're going to provide nail care, let his hand soak for 3 to 5 minutes and clean under his fingernails as needed. While the patient's hand soaks, wash and rinse his arm from the fingers to the axilla, using long, firm strokes and minimal soap and water. Then wash and rinse his hand and dry his entire arm and hand. With the patient's arm raised and gently supported over his head, wash, rinse, and dry his axilla thoroughly.
Do you want deodorant or powder?
If needed, apply deodorant or powder to his underarm. Then at the other side of the bed, lower the side rail, place the towel under the patient's other arm, and clean that arm, hand, and axilla the same way. After cleaning both arms, cover the patient's chest with the bath towel and fold the bath blanket down to his umbilicus. Then bathe his chest under the towel using long, firm strokes. For a female patient, take special care with the skin under the breasts, lifting them up with your hand. Remember to rinse and dry the area well. At this point, check the water temperature and change it if needed. Otherwise, continue by moving the bath towel to cover the patient's chest and abdomen and folding the bath blanket down to just above the pubic region. Then bathe the abdomen under the towel, paying close attention to the umbilicus and skin folds. To wash the lower extremities, cover the patient's chest and abdomen with the top of the bath blanket. Then expose one leg by folding the blanket toward the midline, but keeping the perineum covered. Next, place a towel under his leg, supporting it at the knee and ankle. Now wash the patient's leg using long, firm strokes from the ankle to the knee, and then from the knee to the thigh. After rinsing the leg, dry it well. To continue, wash the foot and clean carefully between the toes. Clean under the toenails if needed. Dry the toes and feet completely, and then discard the towel in the linen bag or hamper. Now move to the opposite side of the bed, lower the side rail, and wash the other leg in the same manner. If the skin is dry, apply moisturizing lotion. After raising the side rail, change the bath water. With fresh bath water at hand, lower the side rail and help the patient into a prone or side-lying position. Place a towel lengthwise along his side or back. and keep the patient covered by sliding the bath blanket over his shoulders or thighs to expose only the area to be bathed. Working from the neck to the buttocks, wash, rinse, and dry his back using long, firm strokes. Then bathe the buttocks and rinse and dry the area. Apply body lotion or moisturizer as needed. When you're finished, cover the patient with the bath blanket. If the patient is able, allow him to clean the perineum himself. If not, perform perineal care for him. When bathing is completed, apply a clean gown or pajama top, dressing the affected side first. As needed, assist the patient with grooming, oral hygiene, and hair care, and then make his bed.
Are you comfortable? How about itches or pain? Would you like to drink before I'll go? I'll just pour some in here for you. Thank you for watching.